Is there a high likelihood that AI, artificial intelligence, could replace medical writing roles? So yes and no, it depends on the type of medical writing. So there are generally two types. So one is regulatory. So that means you're working with clinical trials and maybe documents to help the medical device or medicine or drug that you're working on to actually get through the approval process so then it can go to market. So those kinds of jobs are probably more likely to be replaced by AI. When it comes to the creative industry and also user testing and maybe health information for patients and the public and maybe healthcare professionals and also kind of the sales and marketing side, then I think those are less likely to be replaced because AI cannot be creative. Now, in both cases, in regulations and also the creative industry kind of side of medical writing, you still need data to put into the AI. And so that data needs to be accurate and reliable. And also it needs to be credible information. So if you are inputting data into the AI and then you are prompting it, then it's giving you an outcome which is made up, or it's not accurate. It's probably because of what you put into it, or probably because of the way that you prompted it. So there is an opportunity for AI prompt engineers as medical writers. So I have seen some of those jobs come up where they literally want medical writers to actually train the AI. But AI also cannot work on its own. So you need to know the skill of being a medical writer and actually know exactly how to prompt the AI, because otherwise anyone can just prompt AI, but then they won't know if the outcome is any good. So you do need a bit of the human touch when it comes to AI. And most of the stuff that AI is producing tends to be recycled content. So this means it opens doors for things like bias, for things like old data, and also it might not be culturally sensitive as well. So I think those are all important points to consider when it comes to AI in medical writing. The last point is that pharmaceutical companies and medical writing agencies and whoever you work with is probably developing their own AI. So you're going to have to learn whatever AI they are creating and how to use that specifically. So even if I wanted to learn AI or even teach it, I probably wouldn't be able to give you relevant information apart from basic things like AI prompting. You still need to know the foundation of medical writing before you can even use AI effectively as an AI medical writer, if you like. And the other thing is that whenever you produce something from AI, you need to check that it's not copyrighted. So even Disney right now is suing a image and video generator that is literally just reproducing Disney characters, and that's not legal. So we'll see how copyright kind of affects the use of AI as well, because we all willingly put out information onto the internet, and a lot of that information is actually being used by AI. But if you think about it, that's a very small fraction of the human race and not necessarily all the information that we have. So there is AI kind of proprietary information, and those will normally be kind of locked up in specific companies. So just being aware of that. And so obviously this just makes the market more competitive. So who can build the technology the best? Generally, I'm not using AI. I'm kind of waiting for things to settle. And it's kind of like when you have a new video game and there are lots of bugs in it and people report the bugs, and people report bugs about AI all the time as well. And so, things still need to be fixed. So there's the ongoing maintenance of AI as well. So medical writers will likely play a part in that. So I hope this video gives you some confidence that medical writers are not going to disappear, but the kind of stuff that we do is probably going to change and may involve AI once things kind of settle down, but it might be highly specialized depending on the area of work and where we work as well. So check out medical writing. It's a great career. If you want to learn from me, then check out the link in my profile. Can't get the words out. And I will see you at the next video. Bye.